Health plans usually don't just continue to pay for benefits. Over the course of a policyholder's lifetime, there is usually a maximum benefit limit. These benefit limits are also usually for a specific disease state. So, the health plan will have a maximum lifetime benefit for rheumatoid arthritis, as well as a separate limit for diabetes. Healthcare costs can skyrocket pretty quickly. Coming up with ways to contain these costs is critical for health plans. Ways in which health plans try to keep costs down are to require referral to a specialist, since specialists usually charge more for their services, forcing patients to choose from specifically contracted groups of doctors or hospitals, requiring second opinions, and several other methods. So let's talk about the major types of insurance plans that we will be covering in this course. Such insurance plans are indemnity. Here we see the major types of insurance plans we will be covering in this course, with the exception of indemnity plans. Although we will not specifically be going over indemnity plans, it's helpful to understand what they are. Indemnity plans are what most medical insurance policies in the U.S. used to look like. Simply put, if a policyholder or dependent got sick or required health services, the health plan would pay most of the bill. In many cases, the policyholder owes a percentage of the fees that are billed, usually called co-insurance. This is regardless of the total amount of the bill. So, for example, if the total bill for a specified health service is $2,000, the health plan would pay 80% of this, which is $1,600. The policyholder is responsible for the remaining 20%, which is $400. However, that also applies to higher bills, such as $20,000. The policyholder in this case would be responsible for $4,000. Next up we have managed care organizations. Managed care is a way of supervising medical care with the goal of ensuring that patients get needed services in the most appropriate, cost-effective setting. Managed care popped up to counter the trend of indemnity plans and to provide insurance payers a way to control costs. With managed care organizations, there's a link between provider, patient, and the payer. Instead of only the patients having a policy with a health plan, under the managed care organization, both the patient and the provider have agreements with the MCO. This arrangement gives the managed care plan more control over the services that the provider performs and the fees the plan pays. Managed care is the leading type of health plan in America, and many different kinds of managed care programs are available. We will talk more about managed care organizations in Chapter 3. Next up are the different types of government programs: Medicare, Medicaid, TRICARE, and workers' compensation. Medicare is the federal health plan that provides coverage to most citizens aged 65 and older, people with disabilities, and people with end-stage renal disease, and dependent widows. Medicaid is the government program for low-income people who cannot afford medical care. It is co-sponsored by the federal and state governments. It is run by the state, and matching federal dollars are available for states that satisfy certain requirements, such as providing prenatal care and child vaccinations, among other things. Qualifications and benefits by Medicaid vary by state. TRICARE covers expenses for dependents of active duty members of the uniformed services and also for retired military personnel. It also covers dependents of military personnel who were killed while on active duty. Workers' compensation, most commonly shortened to just workers' comp, is for people with job-related illnesses or injuries. Workers' comp benefits vary according to state law. We will talk about each of these types of health plans in further chapters.